Welcome to the Health Headliner podcast by Tudu Digital. Our content is informational only and not medical advice. Please consult your provider. Now, let's dive into today's headlines.
Okay, so have you ever thought about that cup of coffee you get at work? You know the one. You just grab it without thinking twice. What if it's like secretly messing with your cholesterol, even when you're trying to eat healthy and all that?
That's a pretty interesting question, and it kind of leads into what we're diving into today. We're going to be looking at this new scientific study that really looked into these cholesterol-raising things they found in coffee, especially the coffee that comes from those machines, like every office break room seems to have, right?
Totally. We've been checking out this super interesting health news report from Uppsala University, and we've also got this in-depth research paper from the Nutrition, Metabolism, and Cardiovascular Diseases Journal. It's pretty dense, so we wanted to break it down for everyone. We really want to get to the bottom of what these substances are in the coffee, why they pop up more in certain ways of making coffee, and what it all means for our hearts. So let's just jump right in. What were these scientists even trying to find out?
Well, the main thing they were looking at was how much of these specific compounds are actually in coffee. They're called diterpenes. And the specific ones they focused on were Cafestol and Kahweol. And these guys, they're known to potentially raise cholesterol levels. So they were measuring those amounts in coffee made with those machines you see everywhere in offices. And then they compared those numbers to what you'd find in coffee made at home, using different methods.
Okay, so they're focusing on the coffee we drink at work. But everyone makes coffee differently at home, right? So how'd they factor that into the research?
They actually analyzed coffee made a bunch of different ways, like all the popular home brewing methods. They looked at drip filter coffee with those paper filters, the regular kind, and even those ones with tiny holes that are supposed to, give you more aroma. Then there's percolator coffee, French press, just plain boiled coffee. And get this, they even tested boiled coffee that they poured through a fabric filter just to see. Oh, and they threw in 4 espresso samples too, just to cover all the bases.
Wow, they really did cover pretty much every way people make coffee.
Right.
So then how did they actually measure the amounts of those diterpenes, the Cafestol and Kahweol?
They used this really high-tech method called liquid chromatography mass spectrometry. Imagine a super sensitive detector that can pick out and measure the exact amount of different substances in a sample. That's what they used to pinpoint exactly how much Cafestol and Kahweol were in each and every coffee sample they collected. Pretty impressive.
That's some serious science. So what was the big takeaway? What did they find out after all that?
The biggest thing that jumped out was how much those diterpentine levels changed based on how the coffee was brewed. Coffee from most of the workplace machines had way higher concentrations of both Cafestol and Kahweol compared to, your typical paper-filtered coffee made at home. So basically, that office coffee machine might be low-key raising our cholesterol more than we think, especially compared to what we're brewing at home.
Yeah, that is kind of surprising. Can you give us some actual numbers to show how big of a difference it was?
Definitely. For those workplace machines, they called them brewing machines in the study. The average or median level of Cafestol was 176 milligrams per liter, and the individual samples ranged from 24 milligrams all the way up to 444. For Kahweol, it was pretty similar, with the average in those machines being 142 milligrams per liter and the range going from 18 to 434.
Those are some pretty big numbers. And how did that stack up against paper-filtered coffee?
It was a huge difference. Home-brewed, paper-filtered coffee had way lower levels, significantly lower. The median for Cafestol was just 12 milligrams per liter, ranging from 4 to 24. And for Kahweol, it was only 8 milligrams per liter with a range of 3 to 19. So yeah, paper filtering really brings those numbers down.
Wow, okay, that's a major difference. What about those other brewing methods, like the percolators and stuff?
Right. So for those liquid concentrate coffees from those fancy automatic machines, the diterpene levels were usually pretty low, kind of like paper filtered. But there was this one weird sample that had crazy high levels for some reason. And then boiled coffee, no surprise, had the highest levels overall. It clocked in at 939 milligrams per liter for Cafestol and 678 for Kahweol. But here's the interesting thing. When they filtered that same boiled coffee through just a regular cloth, the levels dropped a lot.
That's a good point about filtering. So what about percolators and French presses? Where do they fall?
The percolator and French press coffee had levels somewhere in between, not as high as boiled, but not as low as paper filtered. They were around 90 milligrams per liter for Cafestol and 70 for Kahweol. Now, espresso was all over the place. Some espresso samples had super high Cafestol, up to 2,447 milligrams per liter, but some were way lower. And lastly, they found that using those fancy aroma paper filters with the little holes didn't actually change the deterpene levels compared to regular paper filters. Oh, and another thing, the Cafestol and Kahweol amounts in coffee from the same workplace machine could be totally different depending on when they took the samples.
Okay, so that's a lot of info about, what they found. But why does this even matter for us, for people listening? What does it mean for our health?
The big thing is cholesterol. Both Cafestol and Kahweol can raise your low-density lipoprotein cholesterol, which is also called LDL cholesterol, or the bad cholesterol. The study actually went a step further and tried to figure out how those higher deterpene levels in workplace coffee could actually affect us.
And what did they find? How much of an impact could it have?
They estimated that if someone switched from drinking 3 cups of workplace coffee a day to 3 cups of paper filtered coffee and did that 5 days a week, their LDL cholesterol could go down by about 0.58 millimoles per liter. So basically, choosing filtered coffee at work could actually make a real difference for your heart health over time. Like, it's comparable to making a healthy tweak to your diet every day.
That's helpful, but I'm not sure everyone knows what that number means in real life. Is there a way to, visualize that?
Sure, think of it this way. The effect on your cholesterol from drinking all that workplace coffee is like adding 60 milliliters of full-fat cream, that's about a quarter cup, to every cup of paper-filtered coffee you drink. And on the flip side, if you tried to cancel out those deterpenes by loading up your coffee with oat milk, let's say 250 milliliters per cup, with a gram of those cholesterol-lowering beta-glucans, it still might not completely counteract that effect.
So even if we try to be healthy with our coffee choices, it sounds like how it's brewed can really make a difference for our heart health in the long run.
Yeah, for sure. Lowering your LDL cholesterol by that 0.58 millimoles per liter is actually linked to a pretty significant decrease in your risk of getting atherosclerotic cardiovascular disease. Over 5 years, it's like a 13% lower risk. And if you think about it over, let's say, a 40-year working life, that reduction could be as much as 36%. That's pretty significant, right?
Definitely something to think about.
Right. The researchers even said that regularly drinking unfiltered coffee at work might be this hidden factor that no one's really paying attention to when it comes to our heart health. And it's worth mentioning that, the latest Nordic nutrition recommendations specifically suggest choosing filtered coffee over unfiltered for better cardiovascular health. So that definitely backs up what they found in this study.
This is all really interesting, but like any research, there are probably some things to keep in mind, right?
Yeah.
Were there any limitations to this study?
Oh, for sure. It's super important to consider the limitations. First off, they only looked at a relatively small number of coffee machines in workplaces, so what they found might not be true for every single workplace out there. Second, they didn't have all the nitty-gritty details on each machine, like the specifics of the filters, the water pressure and temperature, how long the water was actually touching the coffee grounds, and how finely the coffee was ground. All that stuff could affect how much of those deterpenes end up in your cup.
Okay, so there were some details about the machines that they couldn't really account for. Anything else?
Yeah, well, they found a potential connection between how coffee's made and cholesterol levels, but they didn't prove that coffee from workplace machines actually causes higher cholesterol or, a higher risk of heart disease. To really nail that down, we'd need more research, like randomized controlled trials and long-term observational studies. And another thing, the deterpene levels they found were sometimes even higher than what other studies have found, so it's possible they overestimated the impact on LDL cholesterol a bit.
Good point. Anything else we should consider?
Well, they really focused on LDL cholesterol and didn't look at what those diterpenes might do to other fats in your blood, like triglycerides. And lastly, they found a lot of variation in the diterpene levels in the espresso, and they couldn't really explain it. Like, some espresso had tons, others didn't, so that definitely needs more research to figure out what's going on there.
So while the findings are definitely interesting, there's more research to be done. What did the experts who did this study have to say about all this?
The lead researcher, David Igman from Uppsala University, he really emphasized that the levels of these cholesterol-raising substances were much higher in that workplace machine coffee compared to your regular drip coffee maker with a paper filter.
Okay.
He really highlighted how important that filtering step is in getting rid of those compounds.
Right. That lines up with what we saw in the data. Did he say anything else?
Yeah, he pointed out that not all coffee machines filter out those substances equally well. And get this, even the same machine can vary over time. And he also said that most of the coffee they tested had enough Cafestol and Kahweol to actually affect LDL cholesterol and potentially increase the risk of heart problems, especially for people who drink coffee a lot. So based on all that, he recommended sticking with well-filtered coffee to be safe.
Makes sense. Did the researchers have any ideas about why the levels might be so high in some machines?
They think it's because a lot of those workplace brewing machines don't have that superfine filter, so more of those oily diterpenes that are naturally in coffee beans can slip through and end up in the brewed coffee.
Mhm.
And as for why the same machine could have different levels at different times, they guessed that how often and how well it's cleaned could affect how well the filter actually traps those substances, so that might explain the variation.
Oh, yeah, that's interesting. So even just basic cleaning could make a difference.
Totally. And to show how important filtering is, they pointed out that just using a simple cloth filter made a big difference in the deuterium levels in that boiled coffee, so filtering is definitely key. And they also said we need more studies, especially controlled studies with people, to really figure out how much different types of coffee machines affect LDL cholesterol. Plus, they want to do more research to understand how things about the machines themselves affect how much of those deuterpenes end up in the coffee.
So much to learn about coffee. After all this, what's the main takeaway for our listeners? What should they be thinking about when they're, going about their day?
Honestly, the biggest thing is just to be more mindful of how you make your coffee, especially at work. Like, take a second to think about what kind of machine they're using at your office. Maybe even ask about it if you can. And if you can choose, going for coffee that you know has been filtered well, like how you might make it at home with a paper filter, could be a simple but good move for your heart health.
So just being a little more aware of how our office coffee is made could be a surprisingly easy way to help ourselves out in the long run.
Exactly. It's all about paying attention to how much coffee you drink and remembering that how you do it can actually impact your heart health. Who knew, right?
I'm definitely thinking twice about my coffee routine now.
Sure.
This deep dive has really made me wonder what other everyday things that we don't even think about could be affecting our health in ways we don't realize.
Thanks for tuning in to the Health Headliner podcast by To Digital. Like and subscribe for more health news and breakthroughs. Stay healthy and informed. See you next time.